Good morning, everyone. I wanted to talk with you in this lecture about Frances Burney's letter, which is commonly referred to as her mastectomy letter. It's essentially a letter that she sends to her sister, Esther Burney, recounting the experience of having a mastectomy. Now, I wanted to give you some background on the letter about Frances Burney and also just about the course of her surgery. To begin, I want to acknowledge that this letter is shocking and gruesome to read, and I, do hope it wasn't too upsetting. I assigned it to you because it's actually a really historically important letter, as it's a personal record of one patient's experience of surviving surgery, before the advent of anesthesia. And it's actually the experience of someone who's pretty famous. So I want to give you some biographical background on Frances Burney in order to start. First of all, Frances Burney was actually a very famous British novelist in the 18th century. She was born in 1752 and she died in 1840. Obviously, this is a letter to her sister Esther Burney, detailing the mastectomy that took place on September 30th of 1811 in Paris. It was performed by the Baron Dominique Jean Larrey, who was the first surgeon to the Imperial Guard. Now, the surgery was actually successful in two ways. First and foremost, she survived it. And secondly, she actually went on to live for another 30 years after this surgery. But it definitely came at a price. It took her almost 9 months following the surgery to actually write this letter to her sister, and Frances and Esther were extremely close. So, you can imagine how difficult it must have been then to be able to recount this experience even to a most beloved relative. Now, by the time Burney has this surgery and writes this letter, as I mentioned, she's actually a really famous British novelist. Burney had the same level of fame in Great Britain, I would say, as someone like J.K. Rowling does today. She was very well known in her time. She was known to be a good writer. She was known to be really smart as well. So, by 1810, she had written three very successful novels. The first was published in 1778 and is a novel called Evelina. And that novel really catapulted her into fame at the age of 28. She began to essentially kind of hobnob with really famous intellectuals and wealthy people after this novel came out. It sold out. It went through multiple editions. Following that, she published another novel fairly shortly thereafter in 1782 called Cecilia, which really sealed her reputation as just being a really talented writer. And then in 1796, she published a third novel called Camilla. Now, in the intervening years between Cecilia and Camilla, period of about 14 years, there were a bunch of things that happened to Frances Burney. First is that, because she was so famous, she eventually landed a position within the royal court. From 1786 to 1791, she served in the court of King George III and Queen Charlotte. Her official title was the second keeper of the royal robes. And in her letter, she actually alludes to King George. She says that she's really sorry that he's not feeling well. And what she's alluding to is that King George III was suffering at that period of time from what we think might have been an attack of either porphyria, which is a blood disorder, or of mental illness, or both. And then she also refers to the death of Princess Amelia. She would have known both of these members of the royal family. So after 1791, she retires from the court. In 1793, she marries Alexandre d'Arblay, who was the adjutant general for Louis XVI, the French king who was beheaded during the French Revolution. Alexandre d'Arblay was a refugee from France living in England, which is how they met. And he's the one that she's referring to when she talks about her, quote, most sympathizing of partners. And then after they got married in 1794, she gave birth to her son, Alexander. So when she refers in her letter to her two Alexander, she's referring to her husband and her son. And this background, I hope, will help explain why she makes so many personal references about friends and family in her letter. Burney, comes from a very large family, but she also knew a lot of people by virtue of her fame and by virtue of her husband's reputation. So I know there's a lot of personal references. Don't get too caught up in them. I would, just kind of try and move on quickly and just know that you are essentially looking in on someone else's life, and that when she refers to friends and family, she's oftentimes kind of making in references that you're just not going to kind of understand. So let's think a little bit then about the cancer that eventually leads to her surgery. Her letter details when the cancer sort of first becomes known to her through what she says is kind of a slight pain in her breast. There also, as she notes later, is a lump that you can feel that eventually becomes hardened and enlarged. And she, slowly begins to, in the course of trying to get treatment, she becomes weaker and weaker. And by the time she has the surgery, her writing arm has actually become useless. And we're not sure if it's just so painful that she can't write, or if it's numb, or kind of what's going on. In addition to detailing the onset of her illness, Burney also details her own fears and the process by which she seeks treatment for her cancer. We know from the letter that she initially tries to seek medical treatment. That is, she tries to take, pharmaceutical drugs, basically, and make lifestyle changes in an effort to feel better from this cancer. So she tries to consult with two physicians, a Monsieur Bourdois and a Dr. Jouart. And whenever you see M in front of a name in her letter, it stands for Monsieur. And anytime you see MME in front of a name, it stands for Madame. So she is unsuccessful in engaging these two physicians, and she eventually consults with Monsieur Dubois, who was a celebrated surgeon who was serving the Empress of France. She next consults with Monsieur Larry, who is a military surgeon, a celebrated military surgeon. And at Monsieur Larry's advice, she sees Dr. Riebe, who is an anatomist and also a surgeon. She also consults with a Dr. Moreau to see if they can treat that cancer through medicine. And ultimately, after they try medicines, the doctors altogether decide that surgery is the best option for her. And that surgery is performed by a team of 7 health practitioners. Dr. Larry, Monsieur Dubois, Dr. Moreau, Dr. Aumont, Dr. Riebe, a pupil of Dr. Riebe, and a pupil of Mr. Dubois. In terms of the surgery itself, she is given a wine cordial by Dr. Moreau. That is the only evidence of any kind of anesthesia that appears that she's given. And the surgery is performed in her salon, basically in her living room. We know that she sends her husband and her son out of the apartment and goes so far as to kind of trick her husband into leaving the apartment so that he won't be there. She knows he wants to be, but she doesn't want him there. And her letter registers really her profound fear of her surgery and, in a lot of ways, her resignation about death. Now, she has fears that relate to a variety of different factors. But it seems like one of the main ones is actually the outcome of the surgery itself. Now, surgery had in general gotten better during the Napoleonic Wars, but it was still a huge risk, and the chances of survival from a surgery are just not that great in 1810, 1811. First, the surgery is performed with no anesthetic, and it's performed in a non-sterile environment. It's performed in her living room. And it's also performed without any of the hygiene practices that we take for granted today. And there's just so many things to pay attention to in this letter. A few things you might want to think about while you're reading it include the following. First, how does Burney experience the relationship between doctor and patient during the surgery? I mean, I think that relationship is something that is so fascinating. Are the doctors trying to create a sense of clinical distance through, the way that they approach her, just the way that they are talking. And ultimately, are they successful in creating that clinical distance given what Bernie is describing? The other questions are, why does Bernie decide to send away her husband? I understand why she might want to send away her son, but why her husband? And how does Bernie prepare herself mentally for this surgery? How would you prepare yourself mentally for a surgery that's going to be performed with you awake and with no anesthetic? And finally, and I think this is one of the more important questions to think about, does Bernie's letter reflect Elaine Scarry's thesis from The Body and Pain? If you'll recall, Elaine Scarry argues that people struggle to describe painful experiences in language that other people could understand and empathize with. Do you feel like this is going on as well? Okay, these are some questions to think about while you read, and I will look forward to seeing you on the discussion board.